Great. So this, as Sean said, this is a paper about the design of taxes on goods that create externalities. So we're going to focus on the taxation of sugar-sweetened beverages. And we're particularly interested in the impact of market power on the design of these taxes. So this is joint work with my co-author, Martin O'Connell, who is also at the IFS and the University of Wisconsin-Madison. This is very delayed. Is there an issue with the clicker? Or a way I can tap forward? There we go. Okay. Okay, so taxes on unhealthy goods, goods that create harms, sort of in a very general sense, date back centuries, you know, on things like alcohol. We also have taxes on fuel, and more recently there has been interest in introducing these taxes on other goods that are perceived to be unhealthy. So this is a map of some of the jurisdictions across the world that have introduced taxes on sugar-sweetened beverages in the last in the last decade or so. So you can see that these are taxes that are kind of growing in popularity, and the aim of these is to reduce some of the public health costs of associated with consuming some types of goods. The optimal design of these taxes has to take into account a number of different features of behavior and of the market. So on the one hand, you know, we might be interested in using these taxes to reduce, for example, the public health costs associated with people eating unhealthily. But this also needs to be weighed against the impact that it might have on other distortions in the market, such as the exercise of market power and the fact that prices might be set above cost. And then a third sort of consideration faced by policymakers is the fact that it may also impact their redistributive goals. So there's been some work looking at this, for example, on the effect of certain types of so-called sin taxes or tax on food and drink having a greater effect on those with low incomes. So as I said in this paper, what we're going to do is look at how market power affects the optimal design of taxes on sugar-sweetened beverages. So to do this, the paper essentially proceeds in three parts. So in the first part of the paper, what we do is analyze an optimal tax problem. And the idea behind this is really to highlight how market power affects both the efficiency and progressivity of policy. And this allows us to think about how our results relate to some of the existing results in the literature. In order to then apply this empirically to a market of interest, we then use detailed consumer level data to estimate a rich equilibrium model of the UK drinks market. We then embed this model within the optimal tax framework and use this to solve for the optimal policy. We find that the allocative distortions associated with positive price-cost margins on sugary drinks reduce the optimal sin tax rate that the policymaker would want to set relative to perfect competition. But actually there are some offsetting effects going on here, both through the fact that there are also margins on substitute products, so on alternative diet drinks, which acts to kind of raise the optimal rate. And there's also an effect of if you account for the fact that profits accrue disproportionately to those who we might think have lower social welfare weights, such as those on high incomes or flowing overseas, then this also acts to increase the rate the policymaker would want to set. Overall, for the estimation that we conduct, we find that ignoring market power can actually lead to significantly lower welfare than could be achieved at the optimum. Okay, so what I'm going to do is very quickly just sketch the optimal tax framework so you kind of have an idea of when I'm talking about optimal, I mean this in a sort of very precise way of the tax policy that maximizes a government's objective function. So what we're going to do is we're going to have consumers who are going to be making choices over how much to work and how much to consume of a range of goods, both goods that we're sort of focused on, so in this case sugary beverages, but we also allow for them to be buying other consumption goods as well. They're also going to earn, so as well as getting income from the amount that they work, they're going to earn dividend income from their holdings of profits in firms. Second part of the model are the set of firms who are going to supply a set of products in the market of interest. So we're going to assume that some of these create externalities. So in our setting, this is going to be sugary drinks. But there are also going to exist substitute products which don't create externalities. So externalities here are just costs associated with consumption that are not borne by the consumer at the point of consumption. So we're thinking about these very much as being the public health costs associated with consuming too much sugar. Firms are going to be assumed to compete imperfectly, and this is going to lead them to set prices above the marginal cost of producing the product, and thus they're going to earn positive profits. So this is, I promise, the only slide of maths in the talk, and I have put words on to hopefully give you some idea of what's going on. But essentially the problem that we're considering the government as facing is choosing a set of taxes on these goods, so on sugary drinks, for instance, to maximize social welfare. So we're defining this as the sum of consumer surplus across the different consumers in the market. So what this means is it's the utility that they're getting, the benefit that they're getting from consuming different types of drinks, accounting for the fact that they don't like to work, and and the benefit they may also get from other consumption goods. And we're going to assume that different consumers have different sort of welfare weights. So again, all this means is the fact that we might want to weight differently poorer consumers relative to richer ones. The government is then also going to care about the amount of tax revenue they raise. It's going to come both from commodity taxes, earnings taxes, as well as a profit tax. And then there's going to be some external costs, again, so you can think of these as being healthcare costs, which are again borne by the government. So this is a sort of kind of high-level overview of the problem, which then is going to depend on these taxes. And so then what we can do is think about, okay, well, what is, given this objective function, what is the optimal, the best tax rate that the policymaker can set in order to maximize this function, taking into account all of the ways that consumers and firms may respond. So then in the paper, what we do is derive an expression for the optimal tax rate on sugar-sweetened beverages. So this is a sort of, you can think about the optimal policy having a range of parameters, so some types of tax rates that vary across different products, even within the market. So we do some of that in the paper, but I think just for simplicity, it's informative to focus just thinking about a single rate of tax on sugary drinks. So this is going to have 4 components. I've put some references on the slide just for those of you who may be familiar with the existing literature. So the first of these components is an externality correction term. So this is kind of quite intuitive. It's similar to, I put the diamond reference, but also to the Pigouvian approach if you want to set a tax equal to the marginal externality. And then really, what's going on here is that you then need to make adjustments for the fact there might be heterogeneity across consumers, and then also account for the pricing response of firms. Another component of the optimal rate is a market power correction. So the idea here is the government needs to take into account the fact that prices are already potentially different or above the cost of production. And so this is already creating distortions. So what we show is that actually higher margins, so a bigger wedge between price and cost on the taxed externality generating products, acts to lower the optimal rate, while the converse is true for high margins on substitute non-externality generating products. We then have a distributional term in the optimal tax rate, and this is going to depend both on the consumption patterns of consumers across different types of drinks, as well as the impact of the tax on profits. So intuitively, if the poor consume more of the drinks that are being taxed, then this acts to lower the optimal rate. But there is then an offsetting effect by the fact that if the rich consumers hold more profits, and then those profits are reduced, this then has an acts to raise the optimal rate. Then finally, we also show it depends on, there is a spillover to the earnings tax base, but this is actually not sort of, under some assumptions, not relevant in our setting, so I'll leave that one. Okay, so in order to implement this framework empirically, we need to know a range of different things. So first, we need to understand how people substitute between different products in the market. So we're interested in, if we put a tax on sugary drinks, how much do people switch to diet alternatives, switch to products out, buying other things outside of the market? And we want to understand how those patterns of response vary across different types of consumers as well. So those consumers who maybe consume a lot of sugar and therefore have higher associated healthcare costs, and also the relationship with income. We also need estimates of the product's price-cost margins. That's going to be an important input into determining the optimal rates. And then we're also going to need to know, get some idea of the measure of the external costs associated with sugar consumption, as well as the distribution of profit holdings across people. So for the first two of these, what we're going to do is estimate an equilibrium model of the UK drinks market, which is going to allow us to get at the first two parts of these. And then for the second two bullet points, we're going to use some of the evidence from the epidemiological literature and other information on dividend income across households. Okay, so the data that I am going to use to estimate this equilibrium model of the drinks market comes from the market research firm Kantar. So this data have two parts. So in the first part, this is from the Kantar Well panel. So these are households that use a handheld scanner to record all of their grocery purchases that they bring into and then consume in the home. We then, for a subset of individuals from these households, see the purchases that they consume out of the home that they record using a mobile phone app. So the data is really very rich. We see the exact transaction price paid, number of packs bought, a lot of information on the back of packs, contained on the back of packs, such as the nutritional content, whether it was on sale, as well as lots of demographics about the household. So this makes this data really ideally suited for a market level study. So what I'm going to do now is just show you a few sort of simple descriptives of the data so you can sort of get an idea of some of the variation that will feed into the model. So the first of these is that the fact here is that households who have high dietary sugar intake also drink more sugar-sweetened beverages. Now, this doesn't necessarily have to be true, but in this case, it turns out to be a strong correlation. So this graph shows along the x-axis, we have households binned by the share of their overall calories that they get from added sugar. So it goes from about 5% up to 25%. The recommendations are that you should have less than 10%. So you can see that most households are above these recommended levels. And then the dots show the average within these bins of the equivalized amount of sugar-sweetened beverages that they buy each week. So you can see there's a really strong positive correlation here. We can also look at a similar correlation of sugar-sweetened beverage consumption against income. So the relationship here is a bit less stark, but we do nonetheless see that higher income households do consume slightly less sugar-sweetened beverages than poorer ones. So that's on the consumer side. But what about firms? So the drinks market, it may come as no surprise, is highly concentrated. So the two largest firms in the market, so Coca-Cola and Britvic, which is essentially PepsiCo, or makes Pepsi, have a combined market share of 60%. So these are large manufacturers that are producing a lot of products, so they have a large portfolio of different products, and thus it seems likely that they have substantial market power. And so this is why, we think it's going to be really important to take this market power into account when we're thinking about the design of taxes on these goods. Okay, so then in order to estimate this equilibrium model of the drinks market, this is going to have two parts. There's going to be a demand side and a supply side. And these are going to be effectively sort of estimated together, but I'm just going to talk through first the demand model and then tell you a bit about the supply model. So on the demand side, what we're going to do is assume that consumers are making a choice over many drinks products in the market. So we're going to use the data that I've just described that covers both at-home and on-the-go purchases. So essentially what you can think about this model as capturing is each week when you go into the grocery store, you choose from a set of products available which one you want to buy on the basis of its price, whether it's Coke or Pepsi, whether it's a bottle or a can, how large it is. And then this is going to allow us to sort of estimate the preferences across these different characteristics that then when we have these will allow us to predict how people will respond to changes in the prices that they face. So an important feature of the model is that it captures variation in preferences, both across household income and total dietary sugar intake, which I showed you on the previous 2 slides were sort of an important part, important sources of variation, and also across unobservables. So, it's also the case that there's a lot of variation in people's preferences that is not captured just by these observable demographics. And this allows us to then generate sort of realistic-looking substitution patterns in response to price changes. The way we're going to identify the effect of price on demand, so again, this is kind of a well-known problem that in order to causally identify the effect of price on demand, we need some exogenous variation. So what we're going to do here is use the fact that price promotions for these drinks are agreed in advance, and the timing from the consumer perspective is essentially uncertain. So each time you go into Tesco's, you don't know whether or not Coke or Pepsi is going to be on offer, but there is this sort of conceivably random variation that then we can use to identify how people respond to the price changes that they face. From all of this, what we can do is estimate how people switch between all the different products in the market. So if you think, we have these 200 products, and we can then get a matrix of how people switch from product 1 to product 2, and so on. From this, we can then say, well, imagine the price of all sugary drinks increased by 1%. What would be the change in demand for sugar-sweetened beverages? And we show that actually that would fall by about 1.4%. So this is kind of in line with some of the estimates in the existing literature that have used alternative methods. Around 33% of the demand, the reduced demand for sugary drinks is diverted towards alternative diet drinks. So this kind of illustrates the fact that this margin of switching and the relative sort of how competitive these different sets of products are is also going to be important. Okay, so on the supply side, what we're going to do is assume that firms are competing in a Bertrand pricing game, and then solve for the implied costs in a Nash equilibrium. So I won't go into the detail of this, but essentially what we're doing is assuming that firms are profit maximizing. Given the demand model that we've estimated, this allows us then to back out the implied costs of production. These yield costs from which we can then calculate things such as the Lerner index for each product. And the average of these, so this is just the essentially the margin, so price minus cost over price, is around 55%. So really, margins here are substantial, and so market power is really an important feature of this market. Just as an aside, one of the things we do to validate the model is to simulate the effect of the UK's recently introduced soft drinks industry levy, and we show that actually the pass-through that the model predicts, so the amount that prices increase relative to the tax, is very similar to that which we observed in practice. So I think that this helps lend credibility to our estimates. Okay, so that's a sort of whistle-stop tour through the demand and supply model. Now moving on to the results on the optimal taxes. So I talked a few slides ago about the problem faced by this government, this hypothetical government choosing tax rates to maximize their objective function. We can then think about there being, again, to sort of try and understand the forces that are driving policy that are important in determining the rate that we might want to set. Think about two different types of governments. On the one hand, we can think about a government that actually we just take out the redistributional motive. So in this case, they don't care whether or not poor people or rich people benefit, things go to profits or consumers, but just they're interested in essentially maximizing economic efficiency. We think that this is kind of an interesting benchmark. Again, it sort of helps us to compare to some of the results in the literature. But then I think it's important to account for the fact that actually most governments do care about the who gains and who gets the gains from policy changes, and to think about the role that redistributive motives play in determining the optimal tax policy on sugar-sweetened beverages. So I'm going to go through both of these in the next slide. Before I show you the results, I should just highlight how we sort of fill in the last bits that are necessary for this evaluation. So the first is that what are the external costs associated with sugar-sweetened beverage consumption? So this is a tough thing to estimate. These things are sort of, there's a lot of uncertainty, so we show a lot of robustness to this calibration, but we use evidence both from the epidemiological literature and World Health Organization to essentially parameterize the costs associated with sugar-sweetened beverage consumption. And more recently, we've done an alternative method as well, which has given similar results. On the distribution of profits, we use information on the effective corporate and dividend tax rates paid in the UK, as well as information on the distribution of dividend income across household income. And then finally, the weights that the government places on different households are just given as a function of household income. So my last couple of minutes, I'll just show you some of the results. So what this table is going to do is walk through the tax rate, shown in the left-hand column, and the change in welfare, shown in the right-hand column, associated with different types of policy under planners that may have differing objectives or instruments available. So the first row here shows that the optimal tax rate on sugar-sweetened beverages when the planner is only interested in maximising economic efficiency is around 4p, and this leads to an increase in welfare of just under £100 million per year. So just for reference, most of the US and UK sugar-sweetened beverage taxes range from about 7 to 15p, and this is all expressed per 10 ounce to make it friendly to an American audience. Okay, so what would be the implications, though, of ignoring market power here? Well, actually, what would happen is that the policymaker would set a rate that is much higher, more than 3 times or almost 3 times as high as the optimal rate. And this would actually lead to a reduction in welfare. So the fact that there are such substantial price-cost margins associated with sugar-sweetened beverages and failure to account for those would lead to a rate that's much, much higher than would be optimal, given what we've assumed about the externality. Okay, so what about now if we think about the implications of redistributional goals of the planner? So now what we see is actually the optimal rate in this case has increased from about 4p to 6p per 10 ounce. So the reason for this is actually most of the profits flow to those consumers that have lower social welfare weights, and this actually acts to increase the rate relative to that set by a planner who doesn't care about the distributional implications. You'll also note from the right-hand column that the increase in welfare is a lot higher when the planner is inequality averse compared with just interested in maximising economic efficiency. Just to kind of distinguish between these, I highlighted at the beginning that the distributional motives can be separated both into a consumption sort of consideration and a profits consideration. We can sort of separate those out by saying, well, what if the government just 100% taxed all profits? In that case, they would actually set a tax rate that's 3p per 10 ounce, and this is leaving only the consumption inequality consideration as affecting the rate. So here what's going on is the fact that lower income households prefer consuming more sugary drinks, and so this actually acts to lower the rate that they would set. And then finally, again, we see a similar result that ignoring market power leads to a rate that's substantially higher than would be optimal. The final thing just to note is that we also consider, I focus very much on just a single tax on sugar-sweetened beverages. This is generally, with the exception of the banded system in the UK, has been the rate that the way most countries have done this, but there are alternative tax policy instruments one could consider. So you could think about multiple rates. So for example, taxes on sugar-sweetened beverages and a different tax or even a subsidy on diet, zero sugar alternatives. In this case, again, we show that actually, I'm not showing the rates because they vary too much, but the change in welfare associated with these more flexible tax policies are also considerable. So to conclude, I think really the lesson from this paper is that externalities and internalities are widespread. They exist not only on sugary drinks, but also in many other settings. And tax offers a very useful tool for thinking about correcting the inefficiencies that they create. But there's a really important interaction here with market power, both in terms of the fact that there exist these distortions associated with positive margins, but also the fact that firms respond. So again, I didn't really highlight this too much, but sort of one of the things going on in the background of this model is the fact that firms are potentially changing their prices in response to these taxes. So they could be passing on the tax by more or less to consumers, and so it's important to take that into account as well. Another effect that, again, we haven't sort of focused on explicitly in this paper, but is, I think, interesting for future work, is how firms' strategic decisions over other choices, such as the nutrient composition of their products, is also important for thinking about optimal design. So we've shown the importance of this in an application to sugary drinks taxes, but really believe that actually these insights apply more widely. So there's a lot of evidence in of the effect or the importance of market power in things like energy markets. And so when we start thinking about when we're thinking about environmental policy, carbon tax policy, accounting for both the existence of market power and the differences across various markets is going to be really important. So with that, I will pass on to the next speaker. Thank you very much. Oh no, am I taking questions?
Yes. Thank you very much, Kate. Thank you. And now, does anyone have any questions right now? Yes, Frank. If you could,
while the mic's coming, there is one on the chat which I could answer very quickly.
Okay, yes.
So there's a question on the chat that asks about demand curvature, because this is an important determinant of pass-through, which is a great question. Thank you. We're estimating a mixed logit model which doesn't actually impose curvature one way or the other. And one of the exercises that we do is shut down all of the preference heterogeneity in the model and think about what that would imply, and then look at what that implies for pass-through, and find that actually the preference heterogeneity is really important in allowing us to capture the range of pass-through that we can see in practice. So we're not actually assuming either log concavity or convexity there, and therefore we're not ex ante imposing a certain direction of pass-through. Thank you, Jose.
Thank you so much. I think it was a clear presentation. And you talk about the strategies of the firms. Of course, the interesting strategy to look is how they change the portfolio product just before the regulation takes place. So I think, is it a brand now that before only has a sugary product and now they introduce a non-sugary product so they can see substituted within their brand, or is it that they exit on the market? But coming back, when you were showing this graph on concentrations, I thought it was interesting to see what would concentration look like in the market of non-sugar versus the market with sugar. Some products are sugar-free. And then you would think about, if you look at the market of sugar-free product, it's highly concentrated, likely. At least if you look at number of ferment concentration. The one of the sugary product is very fragmented and there is less concentration. So, and if market power depends on concentration, suppose that we take this for true, which is possibly not, then we'll think about perhaps you're taxing a market where there is, let's say, already competition, where the market power should be low. You're picking up a high market power but in principle it could be lower. This is a market power of the production as well as distribution that comes together there. So then the question when you look at this role of redistributions is really, we need to have the full picture there. So what is the role of concentration in the two markets? You're taxing one, moving, say, into the other. And then and then thinking about how the structure of product changes in the market as well, and the composition.
Yeah, they're both great questions. So on the first, in terms of the product portfolio, so I think it's very much sort of an empirical consideration in the market. So in this market, most of the big players, the bulk of the market is made up of firms that have usually both a sugary and a non-sugary version, Coke Diet, Coke, Pepsi, Pepsi Max, and so on. And so because these are kind of established, we think that actually actual product entry and exit will probably not of first order importance. However, I do think that actually that wouldn't be true in all settings. And I think thinking about firms' choice of their both product portfolio, so the products that they offer, as well as changing, so there's been a lot of interest in how the UK tax is structured with these kind of kinks in the fact that you've got a low band and a high band has really encouraged firms to reformulate their products, reduce the sugar content, but sort of locate right at the kink points. That's kind of an interesting feature of that market, and again, feeds into the optimal tax. In terms of the concentration in the different parts of the market, so that sort of summary statistic slide was just across everything. You're completely right that, you know, the sort of the competition between the subsets of the market is key. And that's actually something we do model explicitly, because we're allowing for the fact that, you know, essentially we're just saying we're allowing consumers to switch unrestrictedly across these different products. And then actually we do find that there is a range of margins associated with the different products, which to a certain extent are going to depend on how willing people are to switch from that particular basically the existence of close substitutes. So that's kind of all taken into account within the supply and demand model, but I agree, I didn't kind of fully go into the details.
Okay, thank you very much, Kate. We'll have time for other questions later at the very end, so maybe I think we might come back for that. And now we're going to move on to a presentation by Panos Panagiotopoulos. So Panos, now over to you. Please go ahead.
Thank you.
And Panos is I'm changing seats here and changing mics. So Panos is a senior lecturer at Queen Mary University, and he is especially focused on information management. He's also a fellow of the Alan Turing Institute and has strong interests in digital government, regulation, and data science education. So Panos, over to you.
Thank you very much, John. Hello. Thank you. Good afternoon. This is work that we have done with Professor Francis Bowen, who is also a member of the Center for Competition Policy. And we have been doing this work for a while, since about 2015. I am talking about information-based regulation as an alternative to regulation. And it is an alternative to forms of regulation like taxation. So basically, it's a different way of doing regulation. Although it's a different way, regulators quite like this way, and they have done it a lot in many different forms. So basically, it is when regulators are using ratings, rankings, labels, or any kind of information disclosure as a formal way of regulation. So basically, regulators have to inspect, and they announce the result of inspection, and they tell you, you are now an outstanding school, your restaurant is 5 out of 5 in its food hygiene rating. And regulators in the UK quite like, they actually love, I would say, this kind of regulation because it has many benefits. It does their job for them to some extent because it creates additional pressures around things they have to do anyway, which is inspections. So it's a very good way of maximizing the value of inspections and their own data, and it's also a very good thing for transparency as well. So it's not surprising that many organizations get rated, and all of these ratings are now public. And they also have significant effects. In our area, one of the local schools that used to be outstanding was recently rated as just good. And there was a lot of discussion about this. Mumsnet was on fire. People really wanted to know what is going on over there. Does this make it a better or worse school? That is a very good question. I can't answer that, but at that point, I'm giving this example so that we separate the effectiveness of these schemes with their effects. Effectiveness means whether they're actually fulfilling their public policy objectives. Like, are schools good? Are care quality facilities at the level that we want them? Are our restaurants clean? So that's what we want to do. But they also have effects, and effects is the way people use these ratings, notice these ratings, and react to these ratings. And how organizations respond to being rated that way, which is sometimes very close to what regulators want, and sometimes it has lots of unintended consequences. Out of all of these different schemes, and we have also produced a review of these schemes, that was a base project that we did, and it finished in 2018. Out of all of these schemes, we decided to zoom into the food hygiene ratings and collect data over time and analyze these ratings. The reason being that this is a very rich data set. There are many, many, many food establishments around the country. They get inspected a lot more regularly than other facilities, like schools. And also, we had a little bit of a natural experiment going on across the different countries in the UK, because those ratings, the stickers that you must have seen, so you get rated, the result of the inspection is published on the website, so it's known. The Food Standards Agency has a database for that. Also, the actual sticker that gives you your rating from 0 to 5, if you're in Wales or Northern Ireland, it is compulsory to put this sticker on the door of your establishment. It is not mandatory in England yet. There was some discussion to do this. I think we were getting closer before the pandemic with the legislation required to do this. Maybe we're getting closer. These discussions have paused. At some point they will restart, but the industry does want this, and we will see if it happens. But anyway, it creates a natural experiment for us to look at these differences and see how food-based businesses respond to being rated. So apart from separating the effects and the effectiveness, we want to do this because social comparison ratings are being quite important. And we always had ratings on financial matters and institutional pressures, like things like safety records or social, environmental, and governance issues. And these have always been there, but this is a way of doing social performance, like health facilities that get rated, and of course, restaurant cleanliness, which is not the only reason why somebody would go to a restaurant. Of course, we want it to be clean, but there are many, many other factors that affect our decision of whether we go to a place or not. We are interested here in this set of theories called the behavioral view of the firm, which basically says that when managers, like food managers, are faced with this kind of information complexities, they will react in a way that explains their behavior from a bounded rationality perspective. So they will do trade-offs, they will satisfy and sacrifice other than maximize. Basically, they can't do everything at once. The same applies when they get inspected for the food cleanliness. They will not probably be able to produce a flawless score, so they might have to make some decisions. And of course, this really gets affected by local characteristics, different markets, and different types of establishments, which are things we want to explore here. And if you think about it from a behavioral perspective, there has been a lot of work on nudging and people's behavior in response to frameworks and choice architectures. Well, from the perspective of the regulators, that's also a quite interesting area and quite less explored, actually, because all of these schemes that are being created and they rate organizations publicly, they create all of these consequences and they create all of these behavioral responses. And the least, I think, regulators should be aware of what these schemes do, other than actually serving their public policy aims. So the main question for us here is, how do food businesses respond to being rated via the scheme? This is the scheme, 5 different labels. When you get a rating of 5, it means that you fully comply with Food Hygiene Ratings law. So in theory, it's not a scheme that shows beyond compliance, or at least definitely that's how the Food Standards Agency wants to think about it. Of course, you can be open and in business with a 3 or a 4. If you get a 2 or a 1 or 0 or a 1, you will get re-inspected quite soon and you are expected to improve. The Food Standards Agency designs and sets the scheme, and it is local authorities that do the inspections, environmental officers. And this also varies a little bit between local authorities, depending on their capacity and depending on the kind of establishments they have and how many. So we said that what is quite interesting here is that in England, mandatory display of the ratings is not there yet, although there is a discussion for this. In Wales, we've had these mandatory displays since November 2013, and in Northern Ireland since October 2016. We believe that the scheme has been successful both in raising the ratings, which have been improving over time, and actually in raising the standards, improvement in food standards. There's some good evidence that this is happening, like studies that look at foodborne illnesses and take samples, and they have confirmed that places with better ratings actually do better. And there's actually no evidence saying the contrary. So we are quite confident to say that this seems to be a scheme that is achieving what it wants to. And we are interested in how it affects the rating idea within the organization, the food businesses. You get a single score from 0 to 5 that actually collapses quite a bit of information, because food establishments get rated on 3 different things. One is how hygienically the food is handled, what we call procedures, food procedures. And this is more of a closer kind of common sense approach to what we would think food standards is about. But also inspectors look at the condition of the establishment and the facilities, and they rate that as well. And they also looked at management systems and food documentation. And the condition of the establishment and the food documentation systems are actually things that require usually a good amount of investment to get right, especially for new food businesses or those that are not part of a chain. So they get rated on all of these three things, and it is a system with thresholds. If you do considerably worse in one of these criteria, you are capped in the kind of rating you can get. But also the system is, I don't want to say generous, but it does allow you to get a 5 with violations in every single one of these. Small violations, of course. So basically, what is quite interesting here is that you can get a 5, but you can have violations, some violations, and also in different ones of these criteria. You can have a little bit in all of them, you can have only in one of them. So it kind of collapses the information nicely, but thankfully we can get the different criteria as well together with the overall rating, and this is something we can explore. And the system is designed and applied the same way in Wales, Northern Ireland, and England. In Scotland, they use a slightly different scheme that is not a rating from 0 to 5. So what we did, we started collecting the food hygiene ratings from the public API, the public database. We started in 2015. That was, can't believe it, 7 years ago. And we continued until 2019. Actually, we continued since 2019 too, but as you might imagine, there are some continuity issues with the data set because of COVID, and inspections either were not happening for a while or sometimes they happened remotely. The thing is, different local authorities did different things because they had different restrictions at different times. So it is not possible for us to present a data set that includes all the data. I'm very curious to see what I will see in a week from now when I do the June 2022 data and see how different they are. The data set I will present about today has over 500,000 observations, different inspections, and they come from 286,000 or so different food establishments. So that was data from 2015 to 2019. Everything that sells food gets rated. Supermarkets get rated, hospitals get rated, school canteens get rated. But to be consistent in what we want to say here, we're only including establishments that are accessible to everybody and food is the main business. And this is 4 different types of establishments: restaurants, hotels, pubs, and takeaways. We include only these 4 in the analysis. These 4 types of food businesses usually get inspected every year and a half, every 18 months. But it depends on a risk assessment profile, and it depends on their last inspection. If their last inspection is low, they will get inspected sooner than later. We have a data set here that is quite unbalanced because the rate of inspection happens in a different way in different local authorities, and we cannot control for that. Also, observations are clustered, like around cities. And also, we are looking at lots of independent variables that are time invariant. They don't change every year in our annual data set. For these regions, the analysis is done with random effects models, not fixed effects models, or some variations of these. Basically, we're interested in population averages in the way we have done here, and it is also an ordinal data set because we're looking at the dependent variable, the food hygiene rating, from 0 to 5. And for most of this analysis, we clustered the 0s, the 1s, and the 2s together in one category because they're a lot smaller than the 5s, so that would be a quite skewed data set. That is quickly on the methods. I will present 3 hypotheses here. Our baseline hypothesis is, so within this data set, we can see what happened in Northern Ireland when they changed the policy. We have 2 years of data from Northern Ireland, 2015 and 16, where display of the ratings was voluntary on the doors of food businesses. And we have 3 years of data where everybody was compelled to put the rating on their door. At the same time in England, it was optional to have the rating on the door. And at the same time in Wales, it was compulsory to have the rating on the door on all of these 5 years. So we have some variation there we can explore. Our first hypothesis here, the baseline hypothesis, is that these physical stickers, they will bring attention to the food ratings and they will create pressures for food businesses to improve quickly from one year to the other when you know that in a few months, whatever your rating is will have to be on the door, whereas at the moment it is published in an online database, but definitely fewer people notice this, as we might think. So we are saying that when the policy change happens, we will have higher scores than without the effect of the policy change. Second, following from our behavioral theories, we feel that food businesses will respond to performance expectations based on historical and social aspirations. So this means if you have a score now, you don't want to get worse. And if others around you, similar types of establishments, are better than you, that creates a problem. If they're as bad as you are, maybe it creates less of a problem. So basically, you compare yourself with what you have done before and what others are doing in your area. And this sets your performance expectations and your pressures to improve, or how quickly to improve. So we are saying, and I'm only presenting a hypothesis on historical aspirations here, we are saying that when you receive a rating that is low, and low rating here means 0, 1, and 2 out of 5, then when you do that and there's a mandate to put your sticker on the door, then you're a lot more likely to improve than when you don't have such a mandate. And the third hypothesis is the search for solutions. So basically this means that when managers are faced with this kind of decision-making framework, they can't do everything at once. So they have to make some choices and some decisions. Given that we can see the 3 criteria of the scheme and we can see the breakdown of the ratings, we are saying that yes, when managers do that, when they do it under mandatory display and they know that their sticker will be there for everybody to see immediately, they will definitely maximize the easiest things. They will do everything that can be done quickly. And also, they might do everything else except the most difficult things. So this is something we can distinguish in the data. And I'm sorry if it's a little complicated, but based on the 3 criteria, and the 3 criteria are here, so we are saying that the first criterion, which is the food hygiene procedures, this is probably the easiest in the sense that it needs the least amount of investment or resources to do. So we are saying that when the rating being on the door is mandatory, the managers of food establishments will do their best mostly to improve whatever they can on this criteria, which is the one that needs the least investment. And they will do everything else they can, but if they can't do everything at once, they will leave their lowest score as the one that needs the most investment, which is usually the confidence in management, the food documentation procedures. The structure of the establishment is somewhere in between, because for some places it is easier to improve their structure, and for other places they need a lot of investment, especially if they're in an older building, but this is something we cannot control in the data consistently. So we will see how food managers kind of respond strategically to this criteria of the scheme. And that is called searching for solutions in terms of the behavioral theories. Some descriptive statistics here. The ratings have been improving over time everywhere. This is driven by businesses wanting to improve their ratings, and it is also driven by businesses opening and closing, which is something we cannot exactly monitor the data set, but it's definitely there as an effect. And if you rescale the 3 criteria on a 0 to 5 scale, then we can see that all of these are improving over time. This is what happened in Northern Ireland, that is the top line, compared to what has happened in Wales, which has been fairly stable over the 5 years of our data set, and what has been happening in England, which is also improving over the years. And the last line at the bottom is London, which actually had the lowest ratings in the country, and also improved quite quickly. London still has the lowest ratings in the country, and actually cities do worse than non-cities. So that is, population density is by far the most important statistical factor here. So London, being the biggest city, has the worst ratings. So that is at least the statistical explanation. We can see what happened in Northern Ireland. So we have a data set that is about 6 months before it became mandatory to have the stickers on the doors, and about 6 months after. And you can see quite a big jump between 16 and 17. So basically, whatever improvement can happen was kind of front-loaded and happened as soon as possible, so that food businesses that could improve were ready to improve when the sticker would be there on their door. And always online, of course. Now, how can we compare? And a quick overview of the sample. 90% of these food establishments are in England, 6.7% are in Wales, only 3.3% are in Northern Ireland. So that is a little bit unbalanced here. Half of these establishments are restaurants, 6% are hotels, about 20% are pubs, and 23% are takeaways. In the proportion of these, you can see that they have been improving. For example, almost 52% had a rating on 5 in 2015, and 61% had a rating on 5 in 2019. We are comparing Northern Ireland with 3 different regions of England as a counterfactual, and we have different reasons of doing that. For example, if you see the southwest of England, the ratings in Northern Ireland and the southwest of England were almost the same, the mean ratings, in 2015 and 16. And then suddenly you can see the difference in Northern Ireland and some more gradual improvement in the west of England. And also we have a comparison with the northeast of England, which is the most comparable in size and socioeconomics, and with the east of England because they have more similar regulatory capacities. The number of inspectors per establishment are more similar there compared to Northern Ireland. So if we use these counterfactuals and fairly pretty much everything else in England, and you do these difference in difference models, then you can say confidently that there is a significant effect of the policy change, and in Northern Ireland the improvement was higher than in other regions. I'm not going to go in detail with this regression because I want to go straight into the other two hypotheses, but just very quickly to say business chains also have better ratings than non-business chains. There is an effect of the population composition, so depending on if there's a higher proportion of children or other distribution, some areas have better ratings. Median pay also makes a difference. Areas with better pay have better ratings as well. Right. What did we find about the other two hypotheses? When you get a low score in England, you're a lot more likely to get a low score in your next inspection as well. So basically, establishments that are not able to improve or don't want to improve just don't improve, mostly. So getting a low rating very confidently predicts a low rating in your next inspection. Getting a low rating in Northern Ireland did the opposite. It predicts a higher rating in your next inspection, although this effect is not statistically significant here. But if you compare it to Wales, it is actually quite statistically significant, and it means that when you get a low rating, when display of the stickers is mandatory, you are quite under pressure to do very well in your next inspection, most likely get a 5 straight away. The same applies to the two criteria. So establishments in England where your best score is the easiest thing, they tend to be the ones that have low ratings, 0, 1s, 2, and 3s. But in Northern Ireland, establishments where your best score is the easiest thing, the food hygiene procedures, they tend to have 5s and they tend to predict better ratings. So this means that it is more intentional. And the opposite applies with the confidence rating. So basically the hardest thing to improve predicts a low overall score in England, and it predicts a higher score in Northern Ireland and also in Wales, which I have not presented here, but we also have that comparison as well. So basically, when you optimize everything else, except the most difficult thing, you seem to be doing it intentionally under mandatory display of the ratings on the doors, and you seem not to be doing it intentionally when the mandatory ratings on the doors are not there. Great, and I have these models here in case you want to see them in more detail, or I'm very happy to send a version of our paper. A couple of lessons here. In terms of what we saw, location of the disclosure matters for these ratings. Yes, there is a lot of information online, a lot of ratings, a lot of reviews about these restaurants, a lot of things people have to pay attention to, but when you put it on the door, they will pay more attention to it. It will create effects like this cafe close to my area, which has not 1, not 2, not 3, but 4 inspections, and all of them are there to tell them that they are better than others, probably. So when you try to regulate social performance via these public ratings, definitely you need a non-strict consideration of what you want to do in terms of your policy objectives. Yes, people who do the inspections and people who design the frameworks, they know what a clean restaurant needs to look like and what are the food hygiene standards, but the effect it creates might be in line with what we want, it might be different, or it might have to do, it might be unintended. So that is something to look at. And it applies the same to all of these institutional pressures. Unless they get noticed and interpreted and acted upon in a specific way, they might be inconsequential. In this case, they're not. Just a caveat here that we are treating the food hygiene rating schemes as a nationally consistent schemes because the criteria are the same, but in local areas, they definitely do it differently. For example, when they started the mandatory ratings in Wales, they did a lot of prep work and the inspectors were there. It was just a lot of investment for them. And in England, some areas are a little bit behind in their inspections. You know, councils do have some issues. In other areas, they're not behind and they seem to have more capacity. So it does work a little bit differently. Thank you very much, Sean. Thank you.
Thank you very much, Panos. All right, any comments or questions? We'll go, can we go to the audience first and then we'll have, yeah. So, can you bring the mic forwards, please?
Thank you. I just had a very simple question. I'm wondering, did you correlate consumer behavior and consumer expectations and how they respond to these programs and how their behavior changes?
Right. That would be a very good study, completely different from this kind of study, because we are interested in how organizations respond. The Food Hygiene, the Food Standards Agency has published some research on this, and consumers do notice the ratings. They definitely notice them more when they're on the doors, which is not surprising, but we had to confirm it statistically as well and find a meaningful way to compare it, which was not straightforward here. What do you think? How much do you notice these ratings? You would expect a 5, right? Do you also expect a 5 from your local takeaway, or are you happy with a 3 or a 4? You see what I'm getting at, yes.
If I may, just do you have any information on whether English restaurants put these on their doors only when they have 5s? I mean, do you have that kind of, which might be one strategy. If you don't get a 5, you don't put it on the door, but otherwise, if you do, you put it up.
Interesting. About half of them in England put it on the door, and almost all of them are 5s. I have seen some 4s, never 3.
All right, Farasat, you had a question.
Yeah, something that's not in the data, or at least you didn't mention it, but I'd like to see if you implement this policy where people have to display their quality or make it more transparent, what's the impact on entry, exit, and prices? Because we all want best quality out there, but if the price is very high, maybe I don't mind such a lower quality or 3 rating or 4 rating. I mean, there's a trade-off there, right? So can you tell that from your data, like how many people are entering or exiting? How many restaurants?
Right. It would have been very interesting to confidently talk about births and deaths of businesses. We tried to do that with some ONS data, the business structure database. I spent a lot of time trying to do that. It's not possible to do it, except only for a very small subset of the data set, and it does have an effect because new establishments make investments from the beginning and their facilities are better. Also, chain affiliation makes a very big difference here. I did a lot of work trying to map different chain affiliations, and it didn't matter because any kind of chain affiliations predicts a 5 rating straight away. They just have the resources, they hire consultants, they do their own internal inspection, so they're a lot more ready to get a 5 when they actually get inspected by the councils.
Can I just follow up on that, because I just was wondering about the sort of the Northern Ireland effect, that if it's essentially businesses get a bad inspection and then they exit, and so that you can have that uptick more by survival of firms that will go. So no business actually gets cleaner. The set of businesses are cleaner on average, but I guess you can't distinguish that.
I wish I did. There is no unique identifier of businesses in the data set. So we can't do it conclusively. We have done it with smaller samples. It does seem to be an effect, yes. Although the same businesses did improve as well. Both happened.
Yes. Last comment, and then we move on to the final presentation. Okay.
I have a question. Did you find someone scoring 0 consistently and not caring about improving and still thriving as a business? I was asking him if someone is totally not affected by the willingness to improve.
You are not allowed to score 0 more than once. They will close you down.
That's reassuring. Thank you.
As far as I can see, yes.
Okay, thank you very much, Panos. We're going to move on now to a presentation by Farasat Bokhari. Farasat is an associate professor in the School of Economics.
Sorry about that.
Yeah, I'm just going to come over. Okay. And he's also a member of the Center for Competition Policy for many years. He's a co-editor of the journal Economic Inquiry, and by background, not only an applied microeconomist and expert in industrial organization, but also a health economist with a strong background of specialization in health policy. So Farasat, we'd like to hand over to you to talk about lockdown drinking, the sobering effect of price controls in pandemic.
I'll start with that, and a correction that that's not what I'm going to talk about.
Ah, okay.
There's a small typo in the title of the thing. My fault. Sent the abstract and slides for a different one, and title at an earlier email for a different one.
Right.
So the paper that I'm actually talking about, can we start the slides? Oh, okay. It's in my control. All right, thanks. So it's about banning volume discounts to curb excessive consumption. Okay. And this is an example which was a policy that was enacted in Scotland. The second part of the title should tell you what I'm going to tell you, that there's a cautionary tale over here. So it's with several co-authors, Paul Dobson, who's in the business school, Marcello and Mark, who are in Manchester and in Germany, and in York University as well, actually. So what are we really talking about? So this is the type of deals that you can see in various grocery stores, for instance. Any 3 for the price of 5, for instance. And in any of these places, you can go and get these type of deals for wines, you can get them for beers, and so on. Notice that you can't usually do it for spirits, because you can't really buy, any 3 scotches for the price of whatever. But if you look at the fine print, which I'm going to highlight over here, it says deal not available in Scotland. Okay? So that's what this paper is about. This was a policy that kicked in, which basically said you cannot do these things in the stores in Scotland, and we're going to study the impact of that over here. And the way I'm going to do it is I'm going to use a similar data set that Kate is using, and I'm going to use a similar methodology that Panos is using. So firms can have, nonlinear prices. Essentially, the idea is that if you do these things, you give volume discounts, it's supposed to increase the consumption. And so the policy over here was, if you think that you want to curb excessive alcohol consumption, one way to do it is to, obviously, to go through the taxes or things like that. But here, the idea was, let's see if we can reduce the consumption through imposing these bans. So the question we look at is, did it actually work? Because you can well imagine that if you tell firms that you can't do this, they can change their pricing strategies and other things can start happening. And that's where the cautionary tale will kick in from. So firms can undertake other pricing strategies that can offset the effect of the ban. And then the question, second part becomes is that even if they were not doing that, how will consumers react to this thing? Should we really think of that everybody is homogeneous and that will have the same type of effect, or will some sort of heterogeneity among consumers play a role over here? Particularly when you're dealing with things that have addictive behavior behind them. So for instance, when you're doing it on alcohol, could it be that there could be something else that's going on that we don't typically think of from the traditional microeconomic type of thinking that, you do volume discount and more people will buy. You remove that, less people will buy. So what was the reason behind it? Well, the reason was they thought there was too much alcohol consumption going on, particularly in Scotland. Here's some scary stats about it. Almost 1 in 4 Scots were drinking hazardously or harmfully, according to one of these reports, the NHS report. More than half of violent crimes involved use of alcohol. 51,000 children were living with parents who had an alcohol problem. So the intentions were all very good, that we want to control these things. There's a lot of externalities associated with it. And so essentially they passed this particular law. Kicked in 2011. Now there was a second law that was also passed in 2018, which is about minimum price or price floors, which again is a paper that Kate has already looked at in a different paper where they've studied the minimum price effect. That's why we're not presenting that here. So here we're looking at the 2011 law, which is on the nonlinear pricing. There's been some literature on it. 3 particular papers have looked at this before. One of them used the same data set that I'm going to use over here. We're just reanalyzing it. And then 2 other studies that looked at, one at an aggregate level, the same type of question. Did it have a right effect or not? So the first study found some mixed results. The second one listed over here basically came back and said that, well, it actually had an effect in the right direction, that the alcohol consumption decreased. And then they did a follow-up study, which was, okay, even if it did, what were the impact on the actual health outcomes? Because that's what one of the main things you care about down the road. Surprising, well, not so surprising perhaps, but they didn't find too much effect over there. Okay. So we're going to reevaluate this question. We're revisiting this using the data from the first study. There they had done it in a bit more of an aggregate way. So we're going to go do a lot more microanalysis of that. We're going to relook at that thing, explicitly recognize that price also ended up changing at the same time that the ban kicked in. So accounting for that, what the final effect was on the consumption. Okay. And we're going to account for endogenative prices. We're going to allow for heterogeneity among consumers as well. Okay. So what's the data? Data is the Kantar World Panel. You just heard about that in the first presentation. This is where the households are carrying the scanners with them, and they roll in and roll out of the panel. They scan in everything that they've bought in the grocery stores. We get a cut of that data. We don't see everything that they bought. We see only when they bought alcohol, and we only get that part of the data set. Each participating household uses the handheld scanner to record home purchases. And then we get a lot of information about the household, number of people living in the household, the location of the household, geocode, general geocode about it, not their exact address, some socio-demographic status about the household. We get very detailed information about the type of alcohol they got. So we know exactly that somebody picked up a 4-pack of Carlsberg. We get product characteristics with it. We know the list price that was in the grocery store at that point in time, in the store that they went. And we also see what final price they paid, because the two can be different. Why? Because there's a discount available on that thing, or some sort of a deal available on it. So we see the deal code also on it. If somebody made other purchases, they never bought alcohol, we don't even see that trip in our data set. So that's a bit of a shortcoming. Okay. So we take this data and we convert it into first just the quantity of alcohol. And to convert it into quantity of alcohol, you've seen these letters ABV, or alcohol by volume, that's given in it, which provides you with a percentage. So we turn everything into units of alcohol so that we can compare things like amount of ethanol that might be in a beer versus amount of ethanol that might be in a wine bottle, or things like that. And we do an overall analysis of it after constructing the quantity and price per quantity unit of it. And then we do overall analysis for the total amount of consumption of alcohol you had in a given week by a given household, adjusting for the number of adults in it. And then we do it by the subsegments of it. So how much ethanol you consumed in the form of beers, in the form of wines, in the form of spirits, and in the form of other alcohols. And we don't do much analysis on the last one because we don't have enough observations on that. So we observe weekly purchases for 83 weeks, starting from January 2011, going up to middle of 2012. The raw data set has about 23,500 households in it. We put a lot of restrictions on it. They must be continuously enrolled in our panel so that we can see them, follow them over time. We discard week 1 of the data because Catherine asked me to do that a long time ago, pointing out that there is different time that Christmas is celebrated in Scotland, and that can have some sort of an effect. So in the redo of it, we got rid of that. We use the early points of the data set to construct, to allocate households into low, medium, and high drinking households. And the rest of the data going from week 13 to 83 is what we use in our analysis. So we have price and other characteristics of unit of alcohol. We discount the differences, and we have 15 regions. The data is from 15 regions, 1 for Wales, 9 for England, and 5 for Scotland. Okay. What does the data look like? So I said that we use the initial part of the data, week 2 through week 12, to classify every household into low, medium, and high drinking. And if you look at these households, you'll see that something very spectacular stands out over here, which is that the households classified as low drinking consume roughly about 7.6% of the total alcohol consumption that we saw. Whereas the households that are classified, which are 1/3 of our sample, that are classified as high drinking households, they end up consuming roughly 75% of all alcohol. So all the policies that are directed really ought to be directed towards this group, which is drinking 75% of the alcohol. And we really want to pay attention to this group, how they reacted rather than everybody in the aggregate. So we're going to provide separate analysis for low drinking households, medium drinking households, and large drinking households. Here's just the rough data before we start looking at any analysis on what was the pattern of consumption in Scotland versus England and Wales households combined together in terms of consumption per household adult. And you can see roughly parallel trends going on between them. Of course, they're harder to prove because there's a lot of squiggliness going on, and if you put me through ask me to put it in a lot of econometric machinery and show precisely, well, I'll be able to show most of it, but in some cases it will fail the full proper parallel trends in some small places. But overall, they seem to be working quite well. You can see where the Christmas is. That's when everyone starts buying more alcohol. Makes sense. We're going to estimate a standard Tobit style of model over here. Tobit model is what we'll estimate. So Y star is the unobserved latent variable that is the consumption over here. The variable that we are really interested in, what's called beta 3 over there, that's the interaction of Scotland with post-ban. So it's the standard, if it was a linear model, it would be the standard diff and diff that we'd be looking at. Okay? Beyond that, you don't really need to pay any attention to this equation. I'll walk you through it when the coefficient comes up. And that also we're going to translate into the marginal effect. So recognizing this, we basically say, all right, so we can do this in a Tobit, but we should also recognize that prices can also change when you put in a ban, because retailers are going to react to that. And when the prices change, consumers can change their bundle that they're going to buy because they're buying alcohol. They can start buying different type of alcohol, or they can start mixing it in different ways. So we should recognize that there is a endogeneity of a sense going on, in the sense that the consumer is choosing the price that they pay, even though the prices are the same, but they're picking a bundle of alcohol. So the prices, in a sense, they're picking which price they're going to pay. And they can also, when they're choosing the bundle, they can choose, that can affect the quality of the product, in the sense that it will have different ABV associated with it or other characteristics. So account for those in the analysis as well. And so to deal with the problem that prices will be endogenous, we go and look for some instruments for it, meaning that things that can affect prices, but not directly the purchasing decision. These are traditional instruments used over here. So we use monthly factory prices for indexes for beer, cider, and fruits. We look at exchange rates between sterlings and dollars and euros as well, because some of the products are going to be imported and they will have their costs being changed around those. We also use diesel prices and then interacted those with market shares by different chains in different areas. So I don't think I can jump to instruments right now. I'll just skip to that. Let me move to the results. I will show you 4 categories of results. The last one is the most interesting one in some sense over here. So first for the promotions. The red dots over here, or the red two lines, are for Scotland. The blue ones are for England and Wales. Now, notice one thing. The ban kicks in, that's the vertical line in the green. Before this ban kicks in, there was promotions that were available in Scotland, the multi-buys. This is the amount of promotions that were going on. And that line drops down to near zero, okay, on the right-hand side after the green line. So the multi-buy promotions go away in Scotland, as expected. But notice something weird. The dotted red line jumps up. What's the dotted red line? The dotted red line is other promotions. Because the regulation said you cannot do multi-buys. They did not say what else you cannot do. So there was straight up temporary price discounts. Those jumped up. Now, if you increase temporary price discounts, what do you think is going to happen to the prices? They're going to go down. And so if we regress the prices, controlling for all sorts of things on differences between these countries, the first column, which is the overall price for alcohol, shows you that it went down. Then we look at it prices by component. So the second column, third column, fourth column, and fifth column are prices of spirits, beers, wines, and fabs, respectively. Okay? Except for the last group, all other prices went down. Okay? Now, if you're like me, and you see the price of alcohol going down, what do? You drink. So that's what a lot of these people also did. The consumption went up. If we don't control for prices in the first column, it shows it went up by 8.6%. Then when we say, okay, let's allow for endogeneity of prices, put that in the equation, that's column 2 and 3. Column 3 is the one that you should look at. That's the main effect. And then we say, okay, now let's break it down by types of households. Remember I showed you there were types that were classified as low drinking, medium drinking, and high drinking. So in column 4, 5, and 6, I'm showing you what happened to the consumption levels for those who were low drinking, those who were medium level drinking, and those who were high level drinking. The policy had no effect on the low drinking people. The policy had an increase for the medium level households, and for the heavy drinking households, very high consumption. The rest is the same story I'm going to show you for spirits, except that there's a difference. Remember, the constraint was not binding in the spirits. There is no such thing as buy 2 for 1. However, there was at the same time in the legislation, the placement on where you can place the products or alcohol in the store. So it became that you cannot put it at the front of the store. So for spirits, what it did was no effect on the low drinking. The medium households, it went down. And for the high drinking, it had no effect. Why? Because when you're checking out and you look at a bottle of scotch and you're not low drinking and you're not high drinking, you say, oh yeah, let me buy that. But now you cannot have it on the front checkout, so the consumption went down for the medium level. It did not affect the heavy drinking households because they know where it's sitting in the back of the store. They can get it quite easily. And then very high effect on beer, not much effect on wines once we adjust for prices. But without adjusting for prices, it did have an effect on wines as well. Okay, so there it was working through this thing. So the last part I want to get to over here is I want to explore why is it that consumption actually, even after accounting for the prices, consumption actually go up. And so we have a conjecture over here, which actually I have Ted to thank for, because it was one of his discussions with him that actually led me to start thinking to this thing, which was that, look, maybe what's happening is that even after you control for prices, there's people who drink a lot, and they're using this type of nonlinear pricing as a mechanism to control their behavior. What's that? Imagine that you buy a certain amount of alcohol, and you're towards the end of the week, you're kind of running out. Now, if you go and buy additional beer or additional wine or additional bottle, that will be at a higher rate. It's not that you can't afford it. It's just that there's some sort of a mental nudge that says, let me not buy the extra bottle because it's going to be at a slightly higher rate. So you use it as a commitment device. You wait till the next week comes around, you go for your shopping then, and you buy your alcohol at that point. Okay? So that was our conjecture, and we said, how can we check? So one way to check was, okay, if this is what's going on, then you should see a change in number of visits that they make to the stores. So here's number of visits. I'm almost done. Here's number of visits. We look at the all households, low, medium, and high. And look at what's happening to the medium and high households. The number of visits per week increase. This is weird. It's not that they can't do the math on their own. They can figure this out. They can allocate their budget. This is what we're using to say that perhaps there's some behavioral aspect that also goes in over here. And we should be careful when we're designing such regulation to account for that as well. We also checked for other things. That could it be some sort of a smoothing of consumption? Because some people are on low income, and they're going to basically increase their visits because of that, perhaps. So we basically went and restricted the sample to low-income households and to high-income households to see if the results change. And turns out that it doesn't. So even in the high-income households, we're not doing any smoothing of their income because they're getting weekly pays or something like that. Their number of visits also increased. So you could be earning more than £60,000 a year, and you're still making more visits to the store. So we think that there's some sort of behavioral explanation over here, in addition to the first order effect that prices went down because of retailers reacting in a different way. That's the primary effect. But once that you've accounted for, there is something more that's happening, and that opens up a new whole area of research as well to start thinking about when we're doing these regulations, particularly in the area where there might be addiction involved. We should start thinking of those angles as well. I'm going to stop here.
Okay.
Thank you.
Thank you, Farasat. Very, very interesting, kind of surprising look at the data, and interesting to see how sometimes using the same data set as someone previously can come up with some quite different, subtle differences. Any questions or comments? Yes, Kate.
I was just wondering why the estimated coefficient, the effect of Scotland interacted with the ban, doesn't change when you add in prices.
For this one?
Like between 1 and 2, why there's no effect?
Seems like the diff and diff seems to be working quite well because it's still some sort of a causal effect that you're picking up. We thought that prices would make a big difference over here and quality would make a big difference. We didn't see too much of it in the aggregate. But it doesn't stay the same way in all of them. For instance, if you look at the beers market, the numbers do change somewhat slightly when you put in the price over there and then account for its endogeneity.
Yeah, I mean, it's very interesting because the pictures descriptively, it looks like, I guess I think it's just a little hard to kind of think about what the diff and diff is getting at when you're controlling for prices, and so it's this sort of separate, it's just getting my head around that.
Yeah.
I was just expecting to see that coefficient change if
Yeah.
the prices were, which it seemed like it should, kind of explaining some of that result in some way. But,
Yeah.
That's...
Yeah. And the other thing you'll see with the prices over here is sort of a effect that in the elasticities, for instance, you'll see that when you go from low to medium to high, the households that are drinking more are getting more price sensitive, which is not usually what we think. Certainly in your papers, I've seen that people who drink more also tend to be more price sensitive, I think.
I think it's one of those things where it depends very much on the level of aggregation that you're looking at.
Yeah.
So we found that people who are heavy drinkers are much more willing to switch between products. So if, the price of gin goes up, people switch to vodka.
Yeah.
But actually, overall,
Yeah.
If the price of alcohol goes up, they're a lot less price sensitive. So the level of
Yeah.
aggregation matters, and this is, you know.
This is consistent with that. And one of the things we had to do in there when we were constructing prices and price indexes and instruments for it, we had to be very careful not to use the overall prices. We had to construct prices for that type of households. Why? Because if we looked at the overall prices, then somebody who's not buying in a given week, let's say low drinking people are not buying, versus heavy drinking are buying all the time, when you substitute the average price, you're picking it up from the whole sample, so it looks like that when the price is low, they're actually not buying, so you get rotated demand curves. So you have to work around that problem quite a bit until you get the demand curves to come out right.
Okay.
I got-
Any other?
Sorry.
Yes, yes, okay.
I got two very tiny questions. The one was about the Kantar panel. I was trying to think about people that have got really serious alcohol problems. Do you think that they would be the kind of people that would be on a Kantar panel?
No.
So, so there's a question about, I mean, this all sounds very intuitive, but are we actually capturing maybe the most serious people that this is particularly targeted at? So that's just, I guess, a caveat. But the other point, your picture, that your graph that you showed seemed to show, I think, that there was a period of real discounts, and then they kind of calmed down a bit. And it struck me that basically they're stopping their multi-buy discounts. Strategically, they introduce a load of other discounts, and they do that for a while until the market levels out. And I was just wondering if you in your data, you removed the first couple of months where there's all those kind of strategic initial discounts, whether you still get the same findings.
So first, let me return to the first question. No, I don't think the Kantar necessarily has a good representation of hardcore addiction in there. But what we do have is households that drink a lot. So that's what we're showing. The household markers 3 are the ones that are drinking 75% of the alcohol. In terms of the elasticities, I also think that there is a bit of non-monotonicity. So in the sense that when you go from low versus medium to high, price sensitivity keeps increasing until you get to people who are fully addicted. Then you can increase the price as much as you want to. They're not going to stop drinking or change their behavior too much. But Kantar is not capturing those in general, I think. In terms of the second question that you asked, that is there, I think if I rephrase this, it's almost like, is there a persistence effect of this thing or not? And so we do have some robustness checks of it. We're still working on more of those, but yes, we do see evidence of it, that the effect lasted quite a long time. Now, we can only go up to 83 total weeks, that's all we have. So when we look at it not as a single diff and diff, but we put in some sort of event study type of thing, and we put in additional dummies down the road as well, we're still picking up effects several months down the road as well. So it's still lasting over there as well.
Any other comments or questions? All right, then thank you very much, Farasat.
Sure.
That's great. Thank you, Mary. Okay, now we're going to move over to. All right. Oh, good. Even better. Thank you. Excellent. So we're moving over to the next part of the session, which is to have some discussion. And so we've invited 2 topic discussants to join us today. The idea of being a topic discussant is to engage with the overall topic and potentially with the papers, but not necessarily with the papers. So we have Mary Starks joining us and Tania Vandenbrand. I'll introduce both of them right now. So Mary is a partner at Flint Global. She also, in the past, served as Executive Director for Consumers and Markets at the energy regulator, Ofcom. Must be very happy not to be there right now with the challenges they have. And then Director of Competition and Chief Economist at the Financial Conduct Authority. So over to you, Mary. I'd like to hear your thoughts.
Okay, great. Thank you very much, and thank you very much for the papers, which were extremely interesting. The sort of session topic was controlling consumer harms, with specific reference to food and drink. I'm going to talk a bit about what we can learn about controlling consumer harms more generally in other sectors, and then Tania's going to focus more specifically on online safety, I think. So that's how we're going to divvy it up. So I had sort of three main takeaways from the papers. The first, which was pretty much the moral of Kate's paper, is that market power matters or market structure rather matters for policy design. And there's a few different aspects to that. Firstly, Kate showed how it matters for design of optimal taxation, but it also Farasat's paper also showed how it matters in terms of how businesses react to policy intervention, and you get different strategic reactions depending on the amount of market power you enjoy. And I think the sugar tax example is a very good example of that. So if you're Coke, then your sort of strategic response to the sugar tax coming in is to take all the fridges you've got in the shops that were full of main Coke with a bit of Diet Coke at the bottom, and fill them with Coke Zero and have a bit of full fat Coke at the bottom, and you're sort of able to do that because of your brand power and your marketing heft. So I think, firstly, it matters because of how businesses respond strategically. The second way in which market structure matters is incredibly practical, but the food hygiene example was a very good example of this. In very, very fragmented markets, the job of enforcing whatever the rules are it becomes very sort of thinly spread. So food hygiene inspectors have got an enormous waterfront to cover, and as the paper suggested, information remedies are one way to kind of amplify the effect of the food hygiene inspectors that you do have, but certainly in local authorities these functions are under extreme budget pressure, so there's a real challenge around that. And the observation I would make in terms of seeing these dynamics play out in other sectors is that there may be opportunities for regtech, data, big data, to help sort of with these kind of needle in haystack type problems, trying to find where in the world the problems are, and then send your kind of inspection force on a more targeted visit. And we certainly see that in financial services in areas like anti-money laundering and fraud. I suspect it's going to be a feature of online safety. And I mean, food, who knows, but there's quite a big sort of unstructured data set out there in terms of TripAdvisor ratings and Instagram of food and all that stuff. So maybe there is some hope there as well. The third thing I would say about market structure is just an observation about bigness, big companies and special obligations. Now, obviously, under competition law and potentially under the DMU regime for digital competition for big tech, if that comes in, being very large, being very powerful brings a set of special obligations that go with that. That's not generally true under consumer law or consumer protection regulation. There are sometimes de minimis thresholds that let the very small businesses off the hook for compliance cost reasons. But on the whole, the sort of rules apply to businesses of all sizes. But what we find in kind of public discourse around corporate behaviour is there is this concept of a social licence to operate, and if you are a big company, a big grown-up, mature company, you are expected to behave in a particular way towards your customers, but also towards your staff, as we saw with P&O, and towards the environment. So there's a sort of less codified set of special expectations, I think, on big companies in these areas. So that was thing one, market structure matters for policy design. Thing two is that customer insight matters hugely for policy design, and that came through pretty strongly in the third paper. Different groups have very different preferences and behaviour. I've got a colleague who has spent most of his career in the food and drink industry, and I think you talked about low, medium and high users. He talks about the mainstream market which he calls premium, so that's people who drink Gordon's Gin and Tonic. He talks about value shoppers, and he talks about determined purchasers. And those are three quite distinct types of behaviour. He also told me off for talking about consumers in this sector. He said you have to talk about consumers and shoppers, because less than half of the food and drink that is bought in this country is consumed by the person who bought it. So you've got different dynamics going on with the person who's going to the supermarket and the person who's eating or drinking. And I think an important question for policymakers is whether policy is targeted primarily at one of those groups, or is a sort of broad blanket approach. So, you know, we have policies that are maybe targeted at particularly heavy drinkers, or at the sort of particularly extreme end of obesity. Whereas I'd say the stance on cigarettes and on smoking is that, you know, all cigarettes are bad. So there's a sort of not particularly, there's no desire to kind of differentiate the impact. And I think that matters especially when the product that you're talking about is good for some people and bad for others, or good in some circumstances and bad in other circumstances. And in my experience, the one that came closest to that was a subprime credit, which is, you know, a lifeline for people in certain circumstances, but can also be very bad for people in other circumstances. So there's a big design challenge there. The third point I'd make on customer insight is that it's very important to think about access as well as price. So if we think about gambling, you know, your access to gambling used to be constrained by the opening hours of William Hill on the High Street, and now it's 24 hours at the other end of the internet. Similarly, my colleague who's been in the food and drink sector for a long time said that the majority of alcohol used to be consumed outside the home in pubs, and it's now the majority is consumed inside the home. So again, you haven't got the publican sort of refusing to give you the last drink. So those things make a big difference. And, you know, as you say, it comes down to almost where you put the booze in the shop as to whether the policy has an impact or not. So those kind of logistical, physical things, I think, matter as much, if not more than price. I think my third kind of key point, so market structure matters, customer insight matters. I think the third one is that these kind of policies are often much more complex than they appear, and these papers illustrate that enormously well. And the reason that is a challenge is that these kind of consumer harm policies have often a very direct, intuitive appeal. They seem like no-brainers. They are the stuff of opposition campaigns, backbench MP campaigns. They're kind of very, very direct, and people feel they understand them. They get talked about a lot. They're sort of on the front page of the newspapers. They're not the kind of arcane technical stuff that happens, plumbing that happens behind the scenes in government. And I think that means that there's a real role for you know, people like our experts here to try and sort of unpack some of that complexity. And so some of the things I mean is firstly, you know, what is the purpose of these policies? Are sin taxes about discouraging sin, or are they about raising revenue? Now, you know, your model had both in and dealt with that very neatly, but I think that can get conflated in the public discourse. And it's also quite interesting to think about how, you know, policy on smoking has sort of evolved over time. For quite a long time, the main anti-smoking sort of policy was tax, and it raised revenue. It didn't do very much to deter smoking at all. And the thing that really deterred smoking was restricting the access by banning it in public places and bars and restaurants. So that policy sort of flipped from, you know, basically the impact of it being to raise revenue to being to eliminate the sin. I think the other thing that's very important to unpack is the sort of policy transmission mechanism. So I suppose it's the effects, to use Panos's term, and unpacking how much that is about customer behaviour change, how much is that about people reading the labels on the front of the restaurants, the 1 to 5 rating, and how much is it about the business behaviour change and the business feeling a sense of either threat or pride, or, you know, whatever pressure it is to change behaviour. And I think as a as a rule, this sort of slightly simplified public discourse will tend to overplay or oversimplify the role of customer behaviour change and think that that's going to be more straightforward than it is, and it will tend to underplay or under-examine strategic business responses. So the example of you just do other promotions if you're not allowed to do multi-buys. And so I think the role of these kind of studies in really kind of forensically examining what goes on when you do these things is incredibly important, including all the stuff around the behavioural theory of the firm, which I think is also very interesting. So to sort of, wrap that up, what does it mean for policymakers? First very obvious point, businesses and governments do need to work together to get these policies right. Governments need the kind of customer and commercial insights that businesses have, and businesses need to join the conversation because these are very high-profile issues, and when something must be done, it's much better to do something well-designed and well-targeted. The other point I would make is that it's really important to remember that these things happen against a sort of bigger policy and political backdrop, and policy focus reacts to events. So a couple of years ago, when the government commissioned the report into food strategy from whichever Dimbleby it was, so I get them confused, the focus for that commission was very much about the obesity crisis and about land use and the environment, now that we're outside the EU and no longer driven by the Common Agricultural Policy. This week, the government published its response to its food strategy, and the focus had very, very clearly swung to food security and the cost of living. Now, there are both sort of shallow reasons for that and deep reasons for that, and the shallow reasons include upcoming by-elections in rural constituencies, but the deep reason is that we are actually potentially on the brink of a very serious food crisis, global food crisis. Russia, the Ukraine and Belarus between them account for an enormous proportion of the traded wheat, food oil and fertiliser that the whole world needs. And so we're looking at the kind of dynamics emerging in food that we have already seen in the energy market, and that's going to create some incredibly difficult choices for policymakers. So I think that means that that just reminds us that policy sometimes has to be developed in haste. It can be regretted at leisure, and that's all the more reason to invest time in these kind of studies that teach us the sort of fundamental lessons for what works. That's me done.
Okay, thank you, Mary. Over to you, Tania. I think it's quite, for me it was interesting to ask someone from Ofcom to be talking about this topic, because the reason is that there are strong analogies to things that you may have to do in the future. So I hand over to you.
Yeah, brilliant. Thanks, Sean. And thank you for inviting me. I think all three papers have a lot of really interesting insights that I can see parallels with in the kind of policy questions we're dealing with at Ofcom. Now, before I go into that, I want to a little bit set the scene of the kind of questions that we're working on currently. And that has a lot to do with the fact that we're increasingly spending time online, searching for content and consuming that content, or looking for people to communicate with. And naturally, at Ofcom, we're interested in understanding, how good the outcomes are of consumers when they do that. And I think it goes without saying that online is creating a lot of really good opportunities for us to find exciting content or to create our own and share it with others. But there's also a range of concerns in relation to our activities online when it comes to consuming content and communicating with others. And that is where a lot of our work is currently focusing. Now, in part, those questions are about how much competition is there in online communications markets. But the interests of Ofcom are really much wider than that. So, for example, we're interested in understanding how digitization is impacting the ability of news publishers to monetize their content, and implications for that in terms of the plurality of views that are out there. And we're also interested in terms of the risks that we sometimes face when we access content online, be it coming across illegal content, being terrorist videos, or unfortunately child sexual abuse imagery. but also to keep our children safe when they go online and protect them from content that might be harmful for them. And quite often porn is a relevant type of content in this context. And this particular focus on protecting people from harmful content online is very prominent right now, as the UK government is taking an online safety bill through Parliament. Now, where that ultimately will end up is still a little bit of a question. The bill hasn't been finalized yet. So take my comments of today with a little bit of, wait and see. But hopefully I can draw some interesting parallels between the work that's been done here and the work we want to do there. So for starters, I think Panos' work is probably most directly linked with the kind of thinking that we might have to do as Ofcom when the online safety bill comes into effect. And it's that question of, are there useful metrics that you can create for consumers to use and understand how safe they are when they access a platform online? And question, would they use that information to vote with their feet if they think a platform doesn't offer enough protection? And that in turn might then create incentives for those platforms to improve the processes they have to keep people safe. I think that's a really difficult question. I think it might very much depend on the kind of content we're talking about, the kind of actors we're talking about. But for some of the parents out there, you might be interested in understanding how safe your child might be on different types of platforms. And to the extent you have control over what your child does online, you might be looking at that kind of information. I appreciate that might depend on the age of the child. I think some parents beyond a certain age probably feel like they've lost that control. We also might want to think about other actors and stakeholders that interact with platforms. There might be advertisers out there that don't like the idea of their ads appearing next to potentially harmful content, or pornographic content for that matter. So to the extent with metrics that we might create to give more visibility of content available on platforms, impact advertisers' engagement with those platforms, and how does that in turn create impacts on how platforms protect users? What those metrics would be, I think, will be very interesting for us to work through. But I think there's two things I take from Panos' work that we need to think about really carefully when we work through those metrics. And the first one is how to make sure those metrics have the right amount of prominence so that consumers or advertisers can use them in their decision making in where they consume content or where they put their ads. And I think a second observation that I find particularly interesting, Panos, is this idea of a metric might focus attention on improving protection on particular areas, and does that go at the cost of increasing protection in others? So we need to think potentially quite carefully about what metrics we put out there to create the right incentives for platforms to keep users safe. Now I want to make a brief comment on the two other papers as well. And particularly, Kate, your observation about that potential for competition concerns to interface with all other policy areas is something that we are spending a lot of time thinking about, particularly with our colleagues in the CMA. And that idea that competition can sometimes interface with things like privacy and online safety is something that I think is very interesting, and I hope some of you will do some research on in the future as well. Now we're discussing privacy tomorrow, so I want to focus a little bit on that interaction between competition and things like plurality and online safety. And a really good example of that kind of interaction is the work we did with the CMA recently about exploring the scope for a code of practice to potentially rebalance the relationship between powerful platforms on the one hand and content creators on the other hand. Now, you might imagine that that kind of rebalancing of the relationship can facilitate the monetization of something like news, and that can be a good thing if that promotes the sustainability of news and therefore the kind of plurality of views we have. But that might be a bad thing if that leads to the monetization of things like harmful content. So when we worked with the CMA about how you might formulate a code of practice to rebalance that relationship, we worded it really quite carefully to make sure that we don't sort of inadvertently undermine the ability of platforms to demonetize what might be harmful content. And then my final observation is sort of to Farasat's paper, which I think illustrates very nicely that sometimes as regulators, we can't anticipate some of the effects of our regulation, and really highlights the value of some of these ex-post evaluation studies that get us to understand whether what we wanted to achieve was actually achieved, or whether there are some unintended effects that we want to try and mitigate. And I can't think of a more relevant space for that than digital regulation. And I think if you look at some of the proposals by governments, both on the digital market regime and online safety regime, what you see inherently in this proposal is this idea of iteration. The idea that we'll start with a bunch of code of practice on the competition and online safety side, but also acknowledging that maybe after some time the market has moved on, and that means those code of practice need to change. Or maybe as we see the code of practice take effect in the market, there might be these unintended effects, or we might not quite achieve what it is we want to do. And so the kind of research, Farasat, you're doing there will be so valuable to us as regulators to kind of build that evidence base that we can then use to iterate those codes of practice. And for those of you that I hopefully have convinced to come and join me to do some research in online safety, the current online safety bill draft has actually a section in it for Ofcom to understand the extent to which platforms are sharing information with researchers, and creates an opportunity for Ofcom potentially to write some guidance on how we potentially could improve that sharing of information and help us with this kind of analysis to help us understand impact of policy. So where the bill will end up, still a big question mark, but researchers look out for that and see whether that's still there when we're in the final version. And if it is, I'll be really interested to come and talk to all of you about all the data you've been dying to get but haven't had a chance to see yet.
Okay, thank you very much, Tania. I meant to say, by the way, that you're Director of Economics at Ofcom, so, and in the past have been a consultant, so you have sort of a long history of various types of analyses of competition. So at this point, I'd like to open up to the audience for any other comments or questions. And as I'm doing that, I'm also going to be looking around me here in case you want to nudge or poke one of the others with a question. I know do we have one? Yeah. Okay. Please.
This is targeted to Tania. You mentioned at the end the value of iteration. Do you have thoughts on how best to enable that in terms of what sort of government or legislators can do to enable it to be iterative?
So I think for me it's all about building that evidence base. And to build your evidence base, what you need is ways in which you collect that evidence base. And that can in part come from things like information request powers, which currently are in a draft bill, both I think in terms of the digital market regime and the online safety regime. But also that ability to facilitate research, I think, is something that I think potentially could be quite valuable. Now, obviously, there are a lot of questions there, right? What's the right amount of information to collect in a way that remains proportionate? And I think that is something, as regulators, we have to be quite careful about. We don't want to end up in a world where we put such significant regulatory burden on companies that we essentially push some of them out of the market. And secondly, some of this data might be quite important in terms of how these companies compete. So we can think really quite carefully about how that comes into the regulator and how that might go beyond the regulator as well. So I think those are the kind of dimensions I think we'll have to think through quite carefully as and when the powers do come into place.
Yes, one question in the back and then over to you.
Thank you. Thanks a lot. That was very enjoyable. And I have a question basically for the entire panel, kind of leaning a little bit back. These are the question is about kind of consumer harms. The entire panel is about consumer harms. And sometimes this seems to be a little bit paternalistic. So in each of these talks, kind of I've asked myself, what's the theory of harm? And sometimes kind of, for instance, for us, kind of heavy drinkers, it was very clear kind of if people drink too much, this has high cost for the health care system. So I guess that's a pretty good kind of a justification for interventions. However, if it's the not so heavy drinkers, or if somebody eats a bit too much sugar, whatever a bit is, right, it becomes a little bit cultural, I think. And so I would like to know, and maybe you know more, like in each of the 3 studies, these kind of most problematic groups, do they come from specific socioeconomic backgrounds? I don't know, but probably yes. If so, then who is really controlling whom here and with which right? Right? Is it at the same time that a specific part, say maybe lower class people, kind of are exploited a little bit by the rest of society here? First, they have to pay the taxes, so that's revenue generation. We've heard that, and then and on top, kind of they have somebody else telling them what to do or what not to do, like the devil's advocate.
And if we could jump over also to the last question up at front, please. That's, yeah.
Thank you, and thank you everyone once again for the presentations. I was just interested in the question about how consumers could be helped, or can they even understand the varying degrees of harm. And I think that the last speaker mentioned that, and we had it earlier as well in relation to the restaurants. So, there was the scoring of restaurants, and it struck me that, how does a consumer understand the difference between a 1 and a 4? I mean, a 0, obviously the state decides this is too harmful, you can't operate anymore. But for, does a consumer understand, well, does a 3 mean they found a mouse, or does a 4 mean they don't wash the counter frequently enough, or, it doesn't really mean anything to a consumer. I expect, they just see a number and so that looks okay. But is the underlying assumption they're allowed to trade, therefore it's probably okay? And we're not very good at public messaging in the West. We have our concept of individualism. If you go on a train in Japan, it'll say don't put your feet on the seat, and if you do it, someone will come and tell you not to do it. And in the West, that just doesn't happen. So we're not very good at creating these cultural norms. So in the context of the online world, then, how is a consumer to understand? It's all so complex. Do consumers, no matter what we do, assume if it's online, it's okay, and somebody has already decided that it's okay? Or is there any other way of trying to indicate that there's harms and make consumers understand enough to make choices?
Okay, thank you very much. Well, I think perhaps we'll just. Is there anyone who wants to go first?
I was going to comment on the
Yeah.
first question just quickly. So I think that's a really, really important point, is the great degree of heterogeneity in the costs of consumption. Some people, you can eat a chocolate bar and it's not going to create any cost to society, and then other people, if they're eating 15 chocolate bars a day, that's potentially going to have much bigger effects. I also think things like the overconsumption by children is another big problem, where they're unlikely to kind of fully account for that. And so any policy essentially is going to have to trade off making the sort of the benefits of reducing some of the most socially costly forms of consumption against the costs of, for example, higher prices to other people. The only thing I would say about the sort of poorer people being hit is there has been some interesting work looking at soda taxes in the US, where if you think that actually the costs, so there are healthcare costs associated with diabetes, your teeth falling out and so on, but actually there are private costs that maybe you don't take into account at the point where you're choosing to consume, but fundamentally you're still the one that bears them at some point in the future. And so then, even if it's the case that poorer people are consuming more of the good, they also get the benefits at some point in the future. And so that can kind of change the balance of whether you think they maybe feel like they're worse off in the moment, but actually over the long run, and then that you get into the sort of tricky business of working out what preferences to use when, determining how well off people are, sort of the benefits that people get. But yeah, I think that's a really important point and should be borne in mind when thinking about these policies, is the variation in effects across people and the costs they create.
Okay, and
I did just a linked comment to that, which was, I thought there's quite an interesting distinction between your sugar example, where you basically can kind of compensate for the externalities. So you raise the money through the taxes and it goes to the NHS, not directly, but more or less. Whereas with smoking, you had some of that going on, but then the other externality was typical towards passive smokers. And so you've got a completely uncompensated externality, and that gives rise to another I don't know whether you call that paternalistic or just sort of helping us all live together in a crowded space, but it's a slightly different motivation from saving people from themselves. It's a...
And then,
I have a lot more to say about the food hygiene ratings, but maybe we can keep it to the overall message of the panel.
okay. I'd just like to make sure we address this point of norms and what these ratings mean. So, I mean, do you have any evidence that people understand what the ratings might imply?
The ratings were created.
Do you think having a 1, 2, 3, 4, 5 system is simple, so that has some benefits, but it doesn't tell you if there was a mouse in the restaurant?
Mouse is a straight 0, so that we know. I don't know if everybody knows that. Everybody is and should be working towards a 5. Only a 5 is full compliance with the food hygiene ratings, laws and standards.
But maybe the food standards are too high.
The food standards are too high.
Maybe. No, I'm just saying maybe.
We are going to have new schemes soon where if you get 3 straight 5s in an inspection, then you get an extra rating that says I have always had a 5. I saw it in a Domino's pizza the other day. They're doing it in Denmark, so we're going to get even more complication because yes, from 1 to 5 it's not enough, at least to differentiate performance standards between businesses. So what consumers think about all of this is a lot more complicated. Yeah.
But if I may just address this question of what do consumers think about rating and what message they're getting out of it. I don't know the answer over here, but I've seen information about this thing in other contexts where surgeons were given ratings, and once surgeons were given ratings in terms of how many people died or not died, even though some of those were adjusting for the intake of the patient, the quality of the patient that was coming in, and if that happens to die, then the surgeon was not necessarily being dinged, but that's not how patients saw those ratings in the end, and it did affect some of the surgeons more. So there's this paper by Cutler, I think it's in Journal of Health Economics, that speaks to this issue of how do consumers, or in this case, patients, react to public information about the rating that's been given in general. Because obviously consumers or patients would also not know that 4-star versus a 3-star surgeon or however they were rating, what does it mean? Did they kill the person, or did they leave a scissor inside, or did the person just happen to die because it was a really patient coming in a very terrible condition? So there is, I think, that issue of what consumers get out of it. But here I would think that most people can figure out that 1 or 2 is probably not good in a restaurant, not necessarily that they are not out of compliance, but they would be able to tell that, okay, this has some roaches or something in there.
Well, yeah, and I think he's also talking about future ratings on other types of services and how those might be interpreted. I think we got to close down this session. It's been a fascinating session. Thank you so much to the presenters of the papers and the discussants, everyone here for having some great contributions. Thank you to the audience as well. And we're going to take a coffee break or tea break right now, and then be back in 7, 8, 10 minutes, something like that. Okay.